Hospitals. Good morning. Hello.
Hello, Tari. How are you?
I'm good, Otilia. How are you doing?
I'm doing fine, Tari. Good to be around with you.
Lovely to have you on the show. Okay, so tell us about Zash. Who is Zash?
Thank you, Tari. Zash is Zimbabwe Association of Church-Related Hospitals, which is an organization working with Ministry of Health to complement their services they are offering. And we are a church-based organization which falls under the Zimbabwe Christian heads of Christian denomination. That's about that. We are offering HIV services which are supported by PEPFAR.
All right, and what are we looking at today?
Today we are talking about importance of adherence to acts and retention into care.
All right, let's get into it.
Pardon, Tari?
Let's get into it.
All right. When we are talking about adherence, Tari, we are talking about when a patient or a client follows the prescribed treatment by their doctor or by their nurse, doing it as they are supposed to doing it, taking the correct drug, using the right route, and at the correct time.
Okay, all right. And why is it important to adhere to art? Why is it important? Why is it?
Okay. Tari, taking medications correctly is very important because what we are doing when we are giving people these antiretroviral medicines is we want to suppress the HIV virus.
Mm-hmm.
We want it to be very low in their blood to undetectable levels so that their quality of life improves. So taking medicines correctly, adhering to them is critical to all people who are taking antiretroviral treatment. And also, Tari, for pregnant women, adhering to antiretroviral treatment is very important because we want to reduce mother-to-child transmission. So as long as one is taking their medicines correctly, the chances of them transmitting HIV to their unborn baby become very slim. And also, in addition to that, we want to reduce drug resistance and the risk of switching medicines to those who may not be taking the medicines correctly, and also the medicines may not be readily available. Mm-hmm. So we want to reduce such instances. And last but not least, we would want to reduce morbidity and mortality. Tari atada vanhu vanofa ne-HIV pari zvino kana kuti vanonzi vazoita AIDS. Saka izvozvo tinogona kungozvitopa only if people are adhering to their medicine.
Okay.
Thank you.
Kana tichitaura iyo nyaya ye-adhering to art nekunwa mishonga zvinoita here kuti ndogona kungonwa pandangofungira kana ndakanganwa kuti maiwe ndofanira kunwa na9 zvinoita here kuti ndizonwa zvangu kana kuma12 kana kuma1 kana kuti is there a certain way that I need to be taking my meds?
Okay. Thank you, Tari, for that question. Kana tiri kutaura nyaya yeadherence, tiri kutaura nyaya yekutedzera sezvazviri nemo. However, panogona kungoita mukana yekuti mumwe munhu anogona kungokanganwa kuti angaifana kumwa na9 ozongorememba kuti na10 ndaifana kumwa mushonga wangu, then paangorememba ipapo ngabva angomwa mushonga wake ipapo as soon as they remember. But we wouldn't want them to take quite a long time before they take their medicine, because by so doing takutokanganisa mashandiro emushonga kutsimbirira kwaunoita HIV, so that our health is okay. So we would at all times encourage people to have my reminders, do something that always reminds them when their time is right to take their medicine.
All right. Now, what happens if one does not adhere to their ARV treatment?
All right, Tari. If one does not adhere to their treatment, there are quite a number of things that may happen to their health. First, we are going to have having incomplete viral suppression. What we mean is utachiona uchatsimbirirwe zvakakwana nemishonga. So kana utachiona usina kutsimbirirwa zvakakwana nemishonga, we are going to have them progressing, their disease is going to progress to a situation where they are going to be ill, which is what we don't want. Isusu kana tiri kupa vanhu mishonga yema-ARVs, tiri kuda kuti vanhu varambe vane utano hwakanaka. So when they have incomplete viral suppression, they can get ill at any time with opportunistic infections because their immune system is distracted. And also, they may develop drug resistance. I talked earlier on about reducing drug resistance being one of the important factors of adhering to antiretroviral treatment. So when they develop drug resistance, it means they would want to switch their medicines to a second line or a third line. So this, we don't usually want it because these drugs are not readily available. So we would want our people to adhere and stick to their first line drugs which they started with.
Kana mchiti first, second line is mukureva chiya?
Akandikurira kuti panotanga munhu ma-ARVs ake tari, pane mushonga waanotanga kupuhwa watinoti first line. Mushonga uyu ndo mushonga uri readily available kuma-public sector kwedu, even in some private sector uri readily available. Zvikureva kuti mushonga unowanika nyore uri available ndo yatinoti first line. And then munhu kana asina kuzomwa mishonga yake zvakanaka, zvaakureva kuti pane mimwe mishonga usiri kushanda zvakanaka pamishonga yatinenge tiri kumupa pa-first line. Saka akuda kuchinjirwa kuti aende pane mumwewo pachidanho chiri pa-second line. Kana asina kumwa zvakanaka ipapo zvichida anogona kuenda pa-second line. But however, pane zvakawanda zvinogona kuita kuti munhu ade kuenda pa-second line kana pa-third line zvisiri zvekuti haasi kumwa zvakanaka. Pane zvimwe zvinogona kubatanidzira kuti munhu ade kuchinjwa mishonga kuenda pa-second or pa-third line.
Okay, all right, let's carry on.
Okay, ndanga ndichiri kutaura nyaya zvakakoshera kuadhere to antiretroviral treatment yedu ma-ARVs atinenge tichimwa aya. Tinokurudzira kuti zvakare vanhu vaadhere because zvinoredusawo zvakare mikana yekuti vanhu varware kana kuti vafe kana kuwana urema hune chekuita nezvirwere zvinenge zvakonzereswa nekuti munhu ari kurarama ne-HIV. Saka mukudaro imomo tinenge tiri kuda kuti vanhu varegere kuzosangana nekurwara ikoko kana kuzofa. Panguva ino mishonga payavepo pairi kuwanika kwakawanda, ende uye zvaipo vanhu pavaane ruzivo rwakawanda hatichatarisire kuti vanhu vange vachifa nekuti ane HIV. And also munhu akamwa zvakanaka mushonga wake, ndambotaura nyaya yekuti tinoderedza mother to child transmission. Zvinobatsirawo zvakare izvozvo kuti munhu akamwa zvakanaka anenge akuderedzawo mukanawo zvakare wekutransmita HIV kumwana. Akasangoti adzeya zvakureva kuti utachiona hwakuwanda muropa ari ane pamuviri ogumisira pamwe akuzotapurira HIV kune mwana waakatakura mudumbu chari.
Okay, all right. And how can those taking ARV medicines enhance kana kuti ku-improve adherence yavo?
Okay. Vari kutora ma-antiretroviral medicines avo vanogona ku-improve adherence yavo nekuva nema-support groups anovabatsira kuvakurudzira kuti vange vachimwa mishonga yavo zvakanaka. Vanogonawo zvakare kuita ma-reminders anovakurudzirawo zvakare kuti time yekumwa mushonga yakwana, ndakufanira kunge ndichimwa mishonga yangu. Uyewo zvakare nyaya dze-stigma and discrimination dzinodawo kunge dziri nyaya dzinoitawo zvakare kuti zvionekwe kuti vanhu vari kurarama nevanhu vari kurarama ne-HIV havasi kuita look at them vachivastigmatize kana kuti vachivanongedzera. This will also increase my chances of them not adhering to their treatment. So we would want people to support those who are living with HIV so that they take their medicine very well. And also we encourage them that they identify if they are having any problems so that they quickly seek treatment or they seek medical support so that they continue to take their treatment. And above all, Tari. Nyaya stigma dzinoda kuti dzinyatsokubatwa because kazhinji vamwe vanotadza kumatawo zvakanaka nekunongedzerwa kwavanenge vachiitwa nevamwe vavari kurarama navo kana vavanoshanda navo. Saka tinoda kuti nyaya yestigma ive inonyatsotariswa nevari kurarama nevane utachiona hweHIV uye vachiregera kuvanongedzera. Ivo vari kurarama neHIV, we encourage them to disclose their status to those whom they are free to do so that they can take their medicines very well without fear that other people will point at them or will know that they are taking medicine. So basically that's what they need to do so that they continue adhering to their treatment and also seeking more treatment bodies to support them and encourage them.
There's reactions coming through here. Hansi Shoni, we lost a tenant, Ainyara Kunwa Mushonga. Very, very sad. And you know, sometimes you think in this day and age, we are past that. You know, kudara pawai pashaira tidza. Vudrichierera, miromo ichita say, you know, skin yako yaita zvimwewo. But nowadays, you eat healthy, you work out, you go for your regular checkups. You know, you can be good to go. Kana wakuzonzwa kuti pane munhu ainyara kunwa mushonga, ainyara ani? Ndo mfunzo wangu manje wandinenge ndanawo otilia. But there's another question here for you. How many lines do you have? I think my lines imshonga pa mambotaura to first, second lines. Auntie, how many lines do you have?
Okay. In our country, we've got first, second, and third line.
Okay.
We have first line, depending with where you're taking your medicines. There are medicines which falls under first line. We've got second line. We have got third line. I understand in some instances they can be fourth line. But what I know around, we only have second line and third line being available at our facilities.
Okay, question here. I have someone who is on ARVs who is losing weight. Zvisingaiti asi haasi kana kutomborwara. On tests akangonzi everything is okay. Anonwa mushonga yake nema times anofanira kunwa mapills ake. What could be the reason? Please help.
Okay, thank you, Tari, for that question. If a person continues to lose weight, there are a number of things that can be leading to that weight loss. So it might not be that this person is not adhering to their treatment. So what I could advise is they go to their nearest health facility or to their doctor, they talk to them and get to understand possibly why they are losing their weight.
Okay. All right. Okay, and as such, what are you doing to ensure that those taking ART, or those that are on ART, continue taking their medications, their medicines, and are retained in care?
Thank you, Tari, for that question. So as the Zimbabwe Association of Church-Related Hospitals, with the support that we are getting from PEPFA, we've got quite a number of activities that we are implementing to ensure that all clients that are on treatment continue to take their antiretroviral medicines. First, we've got some staff who are at facilities that we are supporting across the country, and those even who are in Ministry of Health and Council clinics. We've got counselors and nurses who are complementing Ministry of Health work by ensuring that they counsel clients who are going to be starting antiretroviral treatment. They get correct information and the importance of why they need to continue on their treatment. And also, we are doing defaulter tracking as that, working together with Ministry of Health, ensuring that clients who miss their appointments whilst on treatment, they are quickly followed up and returned back to care. And those who have defaulted, we are also following up on them and bringing them back on care.
Okay.
To do this, we are also carrying out outreach activities together with Ministry of Health, moving around, going to where facilities, where clients can get their treatment, where they are staying away from facilities. in view of the COVID-19, it has been noted that my clients said they were losing, they were not failing to go to their drug pickup points because of my issues to do with transport and traveling. So we are going to them to ensure they continue to take their medicines. We are giving them their medicines at outreach points which are closer to them. So we are doing this in partnership with the Ministry of Health. And also, Kari, we have my community peer mentors, NEMA Faith Champions, whom we have trained with support from PEPFA so that they are equipped, they have knowledge to go in the community to counsel clients who are taking antiretroviral treatment. And to do this, they'll be motivating them to continue taking their medicines. So these are some of the activities that we are doing as such to ensure clients continue to take their medicines. And also, last but not least, in view of COVID-19, we have started issuing out drugs for quite a number of months. We are through a multi-month dispensing, where we are giving our clients medicines that last for 3, 4, 5, or 6 months, so that they don't miss their medicines because of issues to do with COVID-19 traveling. So these are some of the things that we are doing as such to try and ensure that our clients out there, they continue taking their medicines and adhering to their medicines and also retaining them in care.
I'm excited about next week's program. Next week on the 17th of September, we're going to be looking at faith healing, the coexistence of faith and art. This one here, I definitely already know it's going to be a big one, and I would like to know reactions and some of those things that not things, but church. Where is the place of faith? Where is the place of medicine? So obviously we've got some people who exercised faith and decided, let me not take my medication, but have now jumped back onto the wagon, and it's going to be very interesting. So make sure to tune in at 11:30 to midday, as we will be looking at that. Now, someone is asking here, I am on art and I need help. Vanowanikwa kupi.
Okay, thank you, Tari, for that question which has been asked. Isusu says that right across the country, we have got mission hospitals and clinics which are offering HIV services, and we have got staff at these mission hospitals and clinics which are there to serve clients who come with any issues to do with their treatment, which includes even adherence. So here in Harare, we are found at 160 Baines Avenue, but these are just offices. But our work regarding working directly with clients, we are working together with Ministry of Health right across the country at mission hospitals and clinics, and even some of our government clinics. We are also there to support activities of HIV care.
Okay, my Judah, I've been on ARVs since 2003. Stress also causes weight loss, lack of proper diet, and maybe this person needs to be tested for TB and cancer. Ndoshurukuyo panapa pa WhatsApp. Okay, Otilia, anything else you want to add? We've got 5 minutes to go.
Okay, Kari. I would like to thank you for that contribution. Yes, like I said earlier on, weight loss is caused by quite a number of things. I didn't want maybe possibly to talk. It could be TB, it could be this, but that point is important. People who are on ARVs, they need to take good diet. They need to also ensure they take TB preventive therapy to prevent themselves against getting TB, because it is one of the conditions that can lead to weight loss and also them being ill. So it is important that they take good diet and also prevent themselves from getting TB. So going forward, my Tari,
my Judah.
My Judah, going forward.
Yeah.
Adherence. We are talking about adherence and retention into care. But I think what time manje with the adherence, not a tanga HIV testing. So in the kamshonga, then choda kuzowa virally suppressed, and we continue to adhere to maintain our health. So, parishioners, I would want also to encourage our listeners to go for HIV testing if they've not been tested, and looking at men, adolescents, and children where we still have gaps. I think it is important for them to take also that bold decision to go and test, know their status. Once they know their status, treatment is now readily available there and there. If they do not have any condition or any disease that may want them to be started treatment later, treatment is now available there and there. Okay. And when they've started their treatment, they need to adhere. They need to adhere. So ARVs works very well if one is adhering to their treatment.
Actually, so side effects here, Otilia, my ARVs, could I maybe van vanenge vachichka, vachiti, kuda, zvinozoita ndinozongoita umo anenge asina rangi wekuti ndikatanga kunwa mapiritsi ndinobva body yangu inobva yatanga kuchinja. Zvaiitika kudhara zviya meno kuti mapiritsi wawo achiri on the market here.
Okay, sir, Tari, thank you for that question. Nyaya yema-side effects yawataura yeTari, zveshuwa inyaya inogona kutoita kuti munhu atye kana kuti asade kuteswa kuti anozomwa mapirisi akaita ma-side effects. Ma-side effects, they are there for all medicines, but for our medicines that we are having now, ma-ARVs atanawo, takutotaura isusu tine new treatment, ine less side effects, less food restrictions, which works well for my clients. Saka we would want to encourage my clients to say, my side effects, because the treatment that we are having now is better treatment, which is having less side effects.
Okay, all right. And how people can get in touch with you one more time, Otilia?
Okay. Here in Harare, we are at number 160 Baines Avenue, and we have got a WhatsApp line, which I can give you the number that we use, 0786 512 772. May I repeat again the WhatsApp number?
Please do.
0786 512 772. Mind you, that sesitapedza hedu ndiyo of our time yakupera. Tine vana nema adolescents. Those are also important when it comes to adherence. They need also to adhere to their treatment. So first, children, they decide for themselves to get tested. They need adult support. So adults out there, may we take our children or our relatives' children we are staying with, or those we know they need testing, to go and test with their consent, so that if they are positive, they get to receive their antiretroviral treatment. And adolescents, we are also encouraging them to take their medicines well. At our facilities, we've got adolescent groups which meet and discuss so that they encourage each other to take their medicines. So these are important groups which need really to be taken care of, and we ensure they are tested and they continue to take their treatment if they are positive.
Okay. Thank you so much, Otilia. Until next week, enjoy the rest of your week.